The rad one?
The rad.
She's like, no.
Alright, you're live.
Rad jaw. I don't know what to call it. The rad jaw procedure. You ready?
Yeah, you're live.
We're live?
Yep.
Hey guys, it's Dr. Emer. We're in West Hollywood and we're doing one of my favorite treatments, which is male facial sculpting with fillers. But the big trend right now is to have that really chiseled, defined jawline. And we did a bunch of females today. Now we have one of our males coming in. And he already has, if you look, nice structure. He's just starting to lose a little bit of volume in some of that structure. So by placing some filler in strategic areas like the mid-face where he starts to see some hollowing under his eyes, the chin to give him a little boldness and some lifting to the neck area, and then also the jawline have more of that 90-degree angle. It's going to give him more of the masculinity, a little more definition without much having to be done. Long term, we'll work on tightening the skin and doing texture, but what we're going to do first is use volume. And how are we using volume today? We're going to use a combination of two fillers because some of my patients like to have a little softer of a look and also reversibility if needed, but then some like to have that collagen production long term. So here we have Radiesse, which inside actually has Voluma. So we've combined two different fillers, both long term, one that's a little more reversible, the other that's a little more collagen stimulating. So he's going to get, and if we look up just a little so I can see, turn this way so you can show everyone this 90-degree angle. We go right to the angle of the mandible, and we just do a little bit. And when people are nervous, you know, with injecting Radiesse, I always tell them subtle bits over time. Just do really small amounts, little depot injections, very little. And what he's going to see more of is this instant gratification from the combination of the two fillers. But then what's great is because he's getting married, we got to keep him looking great for that wedding coming up, all the pictures and everything. Although I will say I've known him for 5 years, and he hasn't really changed much at all. He looks the same, so that makes me really happy. But what we can do is get that immediate result without a lot of lost volume over time because he'll get that collagen production. You can see already a little bit of that 90-degree. Now I want to be a little more accentuating with him. There's some numbing in here, so it does make it look a little bit bigger, and especially with guys, I like to, you know, go a little bit more in terms of volume so they can see it. Now let's turn to the front. Yeah, so like already, if you look here, look at that side. Bite down a second. See that projection right there? We've already started to relax now. We've already started to define that out. The other thing a lot of people don't do is they don't come all the way up to this 90-degree angle. They focus just on the angle of the mandible, which is fine. But by coming up a little bit higher, you create that shadowing effect, and you just get a lot more of the definition. With men, we can do this. With females, we try and keep it a little more subtle. Like the women today we did were a little more sleek. With him here, we're creating more of that squared off look. So if you take a look here now, this side being pretty much complete. How was the pain?
What pain?
Great, I love that. But look now, if you see 90-degree angle right here and a nice tightening effect right in there. So if we look straight on, you can see one side being completed, the other one not. So now we're gonna work our way onto the opposite side, doing that same thing, same volume. He's a pretty symmetrical looking guy, which is great. And let me see it again. Yeah, so now we have that built out. We come over here, we do that same thing. We feel right where that bone is. Go right to that angle, create a nice little depot. And you know, as long as you go slow and take your time, it's all gonna look real good. I always tell people to look all the way up for me with your chin. There you go. So we need to really see right where that angle is. And we can come back and build coming up just like I was saying before. Bite down a sec. Good, so we don't have that volume yet.
What's the depth of injections?
Well, some of the areas are on bone, some of the areas are in the subcutaneous tissue, or what we call the subdermal area. Look all the way up. There you go. Great. And I really want to, again, give him a little more definition right at that 90 degree. This side's a little less defined than the other. So we got to try and define it. Give it a little time. Most guys, they'll bleed here, but very rarely bruise. Almost never. Can you shake this up again or mix this? This is cloud.
What can you do for more long-term results for the jawline?
We could do Bellafill injections. That would give a more long-term improvement. We could also do fat injections or an implant. Our facial plastic surgeon, Dr. Artist, is great jawline implants for some guys that really like how the filler looks. But I will say, you can really build this filler to be quite phenomenal in terms of size and shape. And we're just trying to do, you know, nothing crazy, just a subtle bit, so you can really see the improvement. So I'll hold still, just kind of blend everything. Look straight now. There we go, look up.
Will there be any lumps of mixing hyaluronic acid with Radiesse?
Not in my hands, there hasn't been. But is it possible? Of course. Anything's possible. It's possible with the lumps without anyone mixing. That's me for chin. Hold on. Okay, so let me clean that off. We're going to take a look. Put this down. Alcohol. And now we'll take a look at both sides. Right down a little bit. Good. That side has a little bit more in the projection, so I'm just going to dab a teeny bit into that central projection area. So if you see, this one's clogged. You see when he bites down, go ahead and bite down, this side projects out a little bit more than this side. So right at that area, and everybody's different, some muscles are a little more, we're just going to apply a little bit more into that central area. Bite down again. Good. Now we got more of that projection that I want to see. Great. Okay. So now we're going to fine tune this by doing just a little bit into the chin. His chin already looks really good. I just want to get a little more bold, going down to bone, doing a really small amount. And this is the in thing right now, because it just gives that guy a really kind of defined, squared off look, and I don't know, it just looks super masculine. They look really young when we do it. The rest of that. Oh my god, the jaw is awesome. I can't even show you that. It's so good. And for him, when he smiles, he has a longer smile, so you can actually bring the jawline out a teeny bit if we wanted. So we're going to do that. We're just going to come just like a chin implant. Just going to go a little bit wider. Not a ton, because I don't want to change the overall look of his face.
If you don't aspirate prior to injecting, how can you be sure you don't hit the facial artery?
You can't. But based on experience, I haven't had any issues. And we do this based on experience. I've been doing this for a very long time period. I know anatomy. And aspiration is not the gold standard thing to do. You could use a cannula, turn this way a little bit. But understanding the anatomy, do a really slow injection, small amounts, gives the best overall safety. Perfect. Okay. So we're gonna stop at that, but I want to show him really quick, and then we'll go into doing the separate treatment. Let's show him jawline and chin, because that I think is a good starting point. Then we'll work in mid-face. Take a look, at least for now. Bring this up a little bit. Take a look.
Awesome.
Bite down. Turn this way. 90-degree angle with a little bit of a projection. A little projection, but a little width.
Okay.
And I think, long term, that'll do great.
Yeah.
And you can see, guys will tend to bleed a little bit, but they don't typically bruise. And the other cool thing I know is it also pulled this in, see?
I know. That's what I wanted to do.
I know, and that's the cool thing about it. So we can also tighten the skin and other things, but now we're starting with the volume. So one hand be quiet, now let's move to the next part of his face. Alright, cool, that was great. So now I'm going to reorient what we're going to do. We're going to do this in this room and place that for eyes. Good. Okay, cool.